Okay, another THCV quick bite. Matthew Holt here with Lyle Berkowitz, old friend, who has been in digital health and health tech bloody hell longer than I've been. Lyle, these days you're the CEO of a real company instead of all the other stuff you've done over the years, Keycare, which is putting together, you tell me what Keycare does.
Well, what it does is help health systems and others expand access to care, to help manage the population, increase capacity, etc., by providing a virtual care workforce that is working on our Epic instance. So we, in particularly, can help coordinate care with other health systems that are using Epic.
All right, so I know one of your clients is Spectrum in Michigan. I'm a patient of theirs. It's now 6 o'clock on a Friday, or when my doctor's gone home. What happens next?
Well, these days, a lot of the Epic-based health systems, of course, if you went to MyChart, there'll be a button. It might be called Talk to a Doctor, it might be called Get Doctor Now. Each health system can decide. You press that button, and if they don't have anyone available right away, you're gonna find Keycare available so that you can start a visit within a couple of minutes with a doctor who is connected to your health system via our two Epic talking, be able to take care of you, have your past history, we'll be able to do a visit with you, prescribe medications, diagnose everything, document it, and everything then gets sent back to your health system. So on Monday or next week, if you see your doctor, he'll have access to everything that happens.
So is that in Care Everywhere, or is that like directly into their Epic instance?
We're taking, Care Everywhere is this interoperability between two Epic sites, so that's what moves the data. They have a new functionality, though, called Telehealth Everywhere, which is what allows you to see our doctors when you go in to their MyChart.
Okay, that makes sense. All right, so I've been accusing you for years of being Dinosaur Preservation Society. We've got to accept the fact that health systems have faced down one and taken over the world of whatever used to be digital health, and that's where, if there is digital health, it's happening in the old incumbents, right? What do they need the most? You assume, it's that out of hours sort of tele-doc AmWell approach from way back when to compete with that. That's why they use you. But you also mentioned population health and some other stuff. So what is the balance of activity that's going on to Keycare for?
Yeah. Well, first of all, although I don't disagree, I understand what you're saying. I look at it as expanding the balloon from within to make sure we can succeed.
You have to be nice to know I don't.
What we're doing is, quite honestly, population health and team-based care 101. We're not inventing those concepts. We're simply executing on it in a scalable way by creating a virtualist workforce who can work in coordinated manner with the officeologist, right? We have too long asked our office-based doctors to do everything. In the 1990s, we broke off hospitalists. It's now time to break off virtualists, and we believe that that is a people process technology concept that we're bringing in at scale so that health systems can turn to us and say, look, there's a whole bunch of people that we don't have time to take care of. Or if we do take care of them, that means we can't take care of sicker people. I call that the triple R threat: routine, repeatable, rules-based care. Bottom of the pyramid, of the population health pyramid. Let us take care of that at scale. We can do it economically in a way that makes sense because we're asset light. Meanwhile, you docs in the office take care of the higher complexity patients that have value in the system and which deserve to be in the office. Don't tell them just go to urgent care or go to the ER. If we do all this right, we can double panel sizes, increase convenience for patients, improve quality, improve access.
So right now, are people calling in because it's 6 o'clock on a Friday and they have a UTI, or right now it's more of the activity of Keycare heading towards that, which is figuring out who the patients who haven't been in lately but perhaps need to be prodded about their diabetes management or whatever. What's the balance now? Where do you think the balance is?
Yeah, it's a great question. Day one is urgent care, just pure access. Yeah. It's overflow urgent care. Let's take care of you online so you don't have to take up resources in the office, ER, etc. Let's take care of you earlier instead of waiting a week to get in and have a UTI turn to a pyelonephritis. Let's take care of it quickly. Day 2, 3, 4, 5 will be more of a pure primary care expansion play. So there is basically a evolution of how we come in. Initially, just helping with the overflow of urgent care. Over time, starting to say, hey, primary care doctor, once you stabilize a patient, wouldn't it be great to have a team who can manage your patient conveniently online, open up access so you can start seeing new patients and having more time with complex patients who really need you.
So you and other people have been looking at this for a long time. We're talking about using technology to manage, to essentially, we're talking about top of the license stuff and and managing care more effectively in team-based care, all the rest of it. Are the systems buying Keycare? There are a bunch of people who come to systems to sell population health tools and this, that, the other. Are the systems buying? When you have this conversation with them, are they buying Keycare? Is the answer to that? Does that make sense?
Yeah. Basically, we went live about 2 years ago.
Yeah.
We just signed our 20th health system.
Yeah.
They love this concept. It makes sense because it gives them better access and opens up the funnel, increased capacity, but does so in a high quality, coordinated way. It just makes sense for them. Now, do they need to continue to evolve and use this more and more? Yes. The truth is, primary care and a lot of outpatient care is a loss leader. I hate to say it that way, but it's financially, it only makes sense because it brings people into the system. If what we can do is at a very viable financial way, expand top of line capacity, offload, load balance some of the milder, low value stuff, we're allowing the health system to actually take better care of more patients.
I will go. That's one way of putting it, but I don't know what you're saying. But that's the way they get paid now. And
well, it's important. It's got to work in fee for service, but also work even better in value-based care.
Well, if there was such a thing as value-based care, I'd give you that the same thing would be true, right? You would need to look after to those bigger populations. We just haven't figured out how to get people to be in that world, and we know where they make their money. However, it's I get it, and frankly, speaking as somebody who's used one of those large systems, I don't think I've tried to yours yet, to try to figure out how to get an appointment at some time of the day or night and whatever. Just the pure customer convenience of this should be a big factor for them.
It is. Health systems need to compete, right? Yeah. They're not just competing with the hospital across the street, but with a lot of online entities.
Yep, sure.
If they don't offer something, what they're scared of course, is that patient going somewhere else, finding easy access to care, possibly having a bad outcome, maybe even worse, having a great outcome and leaving the health system. It's about keepage is important, capacity is important.
All right, very good. Wrap it up. Let me know, remind me, how much you guys raised?
So we raised over $30 million to date, and we are, planning to raise more because we're in growth mode right now.
Okay. And you said 20 health systems. That's pretty impressive. I think it was like 3 when we last spoke, and that wasn't that long ago. Yeah. Give me a scale of number of people in the company. How are you managing the doctor workforce? Are they your doctors? Are they somebody else's? How does that operation work?
Yeah, so we have about 45, 50 people in the company, and we're growing. And that's in the general company. We have about 100 doctors available to do urgent primary care. We build up a clinical operations workforce. We have a 50-state medical group. We also partner with specialty cares. Watch for an announcement really soon about a very large specialty group that is going to be partnering with us to provide care to health systems and others soon.
All right, we'll look forward to that. I'm talking with Dr. Lyle Berkowitz. He's the CEO of Keycare. Lyle, thanks for your time.
Thank you, Matt.